Good afternoon, everyone. My name is Honey Lewis, and I am a PhD student at Liberty University, and I am excited to share with you today my research project. The title of my project is People with Impulsivity Problems Can Benefit from Medications Created for Obsessive Compulsive Disorder. Now, the problem that is being investigated is that many people that have a diagnosis of ADHD struggle with the predominant trait of impulsivity. And they struggle with this despite taking their regular medications for ADHD. So the purpose of this study is to explore the possibility that people who have severe impulsivity problems would benefit from medications that were originally created for obsessive compulsive disorder. In this investigation, the variable participant's diagnosis is defined by the participant's diagnostic status. The dependent variable will be the rates of impulsivity that will be measured. To measure impulsivity, we're going to use an fMRI while implementing a go-no-go task. The go-no-go task will reveal an image to the participant that is distracting and unfavorable. The fMRI will be used to measure prefrontal brain regions and show actuation of ornate patterns. Now, current studies show that SSRIs are the most effective medication treatment for OCD. In fact, research points out SSRIs are most effective with reducing impulsive and compulsive behaviors. Clinicians typically prescribe stimulants for the treatment of ADHD. Stimulants have been known to be the most effective treatment for the symptom of impulsivity. However, many diagnosed with ADHD still struggle with impulsivity. Some medications that have been prescribed for people with OCD to help with compulsion and impulsive behaviors are paroxetine, citalopram, and sertraline. Now, for this study, we will investigate sertraline as it has shown the most promising results for both pathologies. Now, as I said, previous research has shown that impulsivity and compulsivity are opposites. However, newer research show a link between the two symptoms. Both pathologies have now been linked to abnormal regulation in neural pathways. This happens within the basal ganglia and the frontal lobe. Also, brain scans have shown neural circuits in the reward center of the brain are overloaded. So since this link has been shown between both symptoms of impulsivity and compulsivity, it is evident that medications could help those with ADHD and high levels of impulsivity. Since SSRIs are prescribed for OCD and stimulants, such as Adderall or Ritalin, are prescribed for ADHD, the combination of these two medications can assist with reducing impulsive behaviors. So, this research study is a pre-post design. We're going to determine if medications typically prescribed for OCD could help those diagnosed with ADHD that have high impulsivity rates. It is predicted that those diagnosed with ADHD that struggle with elevated levels of impulse control would benefit from these medications. Now, for the purpose of this study, the medication that we will use will be sertraline, which has been used for the treatment of OCD. So now I would like to share with you the specifics of how this study will be conducted. Now, there will be 40 adults, 20 men and 20 women. Participants will have a formal diagnosis of ADHD. There will be 25 Caucasians, 12 African Americans, 3 Hispanic Americans, and all of these individuals are located in the southern region of the United States. Now, all 40 of the participants have attained a high school diploma, 32 attained associate's degrees, and 8 have bachelor's degrees. The materials that will be used for this study are an fMRI machine, which has 2 components, an MR scanner, and an EPI pulse sequence stimulus. This will be used to measure specific areas of the brain that are activated when impulsivity is elevated. A go-no-go task will be used via a computer where the participants will be shown an image that is adverse or confusing, and they must choose either to ignore the image or to respond to it by pressing a button. The go-no-go task will be measured by recording the number of responses. Now you can find the go-no-go task on a website called Testable, where they offer a template and they also offer instructions on how to use it. Now I did break up this procedure in steps to assist anyone who would like to run this test again. Step 1, this study will be conducted in a lab, and it will be conducted at the University of Arkansas and at home. Participants will have impulsivity measured using the fMRI and the go-no-go task before taking the OCD medications. The results of this test will be checked, rechecked, and recorded by both medical staff and researchers. That is step 2. Step 3, participants will return home and begin taking the OCD medications. Now, participants must take medications for 60 days consistently, and any missed doses of medication will be assessed by medical personnel. Participants will report back to the lab in step 4 and have the same test implemented using the fMRI and the emotional go-no-go task. Step 5 will be where the results will be checked and rechecked and recorded by both medical staff and researchers. Step 6, once the study is concluded, participants will be debriefed. Now, debriefing will include the procedures, the purpose, the hypothesized results, and the actual results, and include any relevant background pertaining to the study. Okay, so I just want to take just a minute and thank you all for listening to my research presentation. I do look forward to hearing your thoughts and suggestions going forward. God bless you all and have a fantastic day.